This is empty can test for shoulder impingement. The patient will be standing and you will elevate the patient's both arms in 90 degrees forward flexion, and then you will fully internally rotate the arms so the thumbs are facing down, and then you will apply downward pressure. A positive test is when you reproduce the pain of the injured side.
Hawkins-Kennedy test. Have your patient at a sitting position. Elevate the arm to 90 degrees forward flexion and have it rest on one of your arm. Then perform passive internal rotation. Positive test is provoking pain, indicating that the patient may have a subacromial impingement.
This is Neer's test for shoulder impingement. The patient will be sitting and you'll place one hand to depress the scapula, and then with the other hand you will internally rotate the patient's arm and then perform maximum forward flexion in the glenohumeral joint. A positive test is when you can reproduce the pain on the injured side.
Drop arm test. Have your patient in a standing or sitting position. Bring the affected arm into 90 degrees of abduction and external rotation passively. Then tell your patient to hold the position and release your supporting arm. A positive test for full thickness tears of the suprainfinatus if your patient is unable to slow the downward movement.
This next test is for shoulder impingement and is the painful arc sign. You ask the patient to stand and slowly abduct their arms with thumbs pointing upward. If there is pain in the range from 60 degrees of abduction to 120 degrees, this is a positive test for shoulder impingement. And if there is pain in the 170 degrees to 180 degrees, this could be a acromioclavicular problem.
Dugas test. The patient is seated or standing and touches the contralateral shoulder with the hand of the 90 degrees. Flex arm of the affected side, then attempt to lower the elbow to the chest is made. AC joint pain suggests joint disease, such as osteoarthritis, instability, disc injury, or infection.
This is the anterior apprehension test for shoulder instability. The patient is supine and then you abduct their arm to 90 degrees and then add maximum external rotation to the glenohumeral joint. A positive test is indicative of pain. This is the posterior apprehension test for shoulder instability. The patient is supine and you bring their arm to 90 degrees, then let them place it on opposite shoulder, and then you place your other arm on under their scapula, and then you push posteriorly and then horizontally adduct and medially rotate. A positive test is pain.
Anterior and posterior drawer tests. The patient is either seated or lying down in supine position. To evaluate the shoulder, use one of your hands to stabilize the clavicle and superior margin of the scapula while using the other hand to move the humeral head anteriorly and posteriorly. Apley scratch test. Patient will try to bring the hands together on the back, while one hand comes from above and the other below. Patient should repeat the movement with switch arms. While the patient is doing this, examine any differences. This allows you to assess the shoulder's functional capacity.